and welcome to Live Healthy West Virginia, the podcast brought to you by WVU Medicine, aiming to help everyone live a better, healthier life in West Virginia and beyond. I'm your host, Mary Ravazio Menard. Bladder cancer is one of the most common cancers in America, and especially in West Virginia, where smoking rates remain among the highest in the nation. The good news is that awareness, early detection, and advances in treatment are improving patient outcomes every year. So today, we're talking with Dr. Hajiran, Urologic Oncology Chief at the WVU Cancer Institute, about advances in bladder cancer, giving patients new hope for better outcomes. Welcome, Dr. Hajiran, to Live Healthy West Virginia.
Thanks, Mary. It's a pleasure to be back. Thanks for having me.
We love having you
Yeah.
back. We love having you back. So let's start with, how common is bladder cancer in the United States?
Sure. Well, bladder cancer is one of the most common cancers in the United States. It's more common than people think. It's one of the top 10, and about 80,000 new cases are diagnosed every year. And this year, we expect about 17 to 20,000 patients will actually die of bladder cancer. And so, one of the reasons why it's very important to know about and is that bladder cancer is one of the ones that recurs more commonly than other types of cancer. And
Really?
so, which means that we need to follow patients very frequently and up to many patients for their entire lifetime. So, out of all the cancers that there are, it's one of the most expensive cancers because of the relapse rate so high. And so, common cancer, high relapse rate, important one to talk about. I'm glad we get to talk about it today.
So once you've been diagnosed, you need to be followed.
Absolutely. Most patients are followed for their lifetime, and depending on which type, which we're going to talk about, the treatments vary, but follow up is essential part of bladder cancer.
I hate to bring this up because West Virginia, we lead the nation in so many bad things, but what's the rate like for bladder cancer here in the Mountain State?
Yeah, for West Virginians, bladder cancer hits West Virginia hard. It hits us different than other states, and for a lot of reasons. One that we talked about already is smoking. Tobacco use. Tobacco use in West Virginia is higher than other parts of the country. Also, occupational exposures in our environment, mining, industrial jobs. Exposures to dyes and certain solvents and chemicals. These are all risk factors for bladder cancer, and so here in West Virginia, our rates of bladder cancer detection and people passing away from bladder cancer is higher, and the complexity of the cases are higher. Another thing about West Virginia too is that in many of rural parts of our state, there may be limited access to health care, and patients
Yeah.
may not get early detection, and so we're dealing with more complex cases, and that's why having a good team is really important for something like this.
We're always fighting that battle.
Yeah,
Mhm.
absolutely.
Are there any more risk factors other than what you just mentioned?
There for the most common type of bladder cancer, which is called urothelial bladder cancer, typically smoking, tobacco use is the number one cause. Industrial exposures. Also, patients can develop another type of bladder cancer called squamous cell bladder cancer, which
Hmm.
is seen in patients that have chronic irritation of their bladder. People that have had catheters for several years, prolonged periods of time, recurrent stones in the bladder, and sometimes patients that have had radiation for other types of cancer sometimes can potentiate a bladder cancer. So those are the main risk factors to think about.
So, what are some of the symptoms we should be looking for of bladder cancer?
The main one that we see is blood in the urine. So, blood in the urine is the number one symptom that patients can have. Now, not all patients with blood in the urine are going to have bladder cancer, but that's the most common symptom that we look for, and it's not. So, we encourage all patients that have blood in their urine to get checked out and to know that it's not a normal thing. And more
But you
advanced.
can't always see it. I mean, it's not a naked eye thing all the time, right?
True. Yeah. Sometimes it's subtle. Sometimes patients can have basically like tea-colored urine or rusty-colored urine. They may not see red blood in the urine, and sometimes it's picked up microscopically. We're able to detect early cancers that way. But if you see visible red blood in the urine, if something's a little bit off, it's always good to get checked by a health professional to make sure something's not wrong. But as far as other symptoms in more advanced cases, patients can even have back pain, weight loss, things like that. Those are more advanced cases of bladder cancer. But we typically blood in the urine is the early first sign that we see.
Now, If you have blood in your urine, is that automatically, does that mean you have bladder cancer?
Blood in the urine is never normal, but there are other reasons to have blood in the urine that aren't because of cancer. So, for example, kidney stones, urinary tract infections, but because blood in the urine is associated with bladder cancer, which is a very serious disease, we recommend that all patients, when you have blood in your urine, to let your primary care doctor know, and not to put it off for a long period of time. When we see patients get into real trouble is when they see blood in the urine and they ignore it for months to years, and then the cancer can become more advanced and harder to treat at that point.
Is there any pain involved in these symptoms?
Sometimes it's painless in the early stages for bladder cancer. Patients may not have any pain, and then they just see blood in the urine. But some patients also can present with some urinary urgency, frequency, kind of symptoms like you're having a urinary tract infection, and so that can also be another way that this presents.
So you shouldn't just try to drink cranberry juice and hope it goes away, right?
Exactly. That's where people can get into trouble. So that's why we're here, and to manage this problem. And so we just want people to know that it's never normal to have blood in your urine. If you have it, let your doctor know.
Okay. So when should we see a doctor?
So mainly when you see that blood in your urine, call a doctor and let them know, hey doc, I have blood in my urine. They might want to start doing a few tests on you. One would be a urine test to look microscopically for blood, and then once patients get to the urologist, the way we find bladder cancer is usually through a combination of blood test, urine test, and then we put a small camera and do what's called cystoscopy, where we put a small camera into the bladder and take a look around, and that way we can find any abnormality. And if we see something abnormal, then we take patients to the operating room to do biopsies of the bladder.
Okay. Is that a way to rule it out as well?
Yeah, that's the way we rule it out. Is the main thing we use is that scope. It's called cystoscopy, and we can
Mm-hmm.
do that even in the clinic. It's a small scope goes through the urethra into the bladder to take a look around. Also, in some cases, we do imaging too to look at the kidneys and make sure there's no blockages and look for any large masses in the abdomen.
Okay, good to know. Um, how do you diagnose bladder cancer? I mean, you kind of just touched on it, but are there any other ways?
There's some new tests that are looking at, are there ways that we can look at markers in the urine, specifically like DNA in the urine, look at the cells in the urine. These are sometimes we can use them along with the scope, but looking at the bladder directly with the scope is currently the gold standard of looking for bladder cancer, finding it. And then in more advanced cases, we use CT scans, and then also sometimes PET CT scans in more advanced cases as well.
Oh, wow. Okay. So what's the difference between non-muscle invasive and muscle invasive bladder cancer?
Sure, that's a
Mm.
really important question because it really changes the way we treat and think about the disease. So for non-muscle invasive cancer, the bladder has multiple layers, and if you think of a plant that you just go and plant in your garden and you pull it right up, it's easy because the roots haven't gone very deep into the ground. And so for non-muscle invasive bladder cancer, it's just that superficial layer, early detection. So we're able to treat a lot of those patients by scraping out the bladder tumors and giving medicine in the bladder to help lower the risk of recurrence and progression.
So it hasn't reached the muscle tissue yet.
Hasn't reached the deep muscle tissue yet.
Okay.
So that's
Okay.
called non-muscle invasive bladder cancer. High risk of recurrence, but we can use certain medicines to lower that risk, and we can use minimally invasive things for people to keep their bladder and treat the cancer. Now, for if we think of muscle invasive, you think of like trees where the roots go very deep down into the deep layers, and so those are harder to treat with just minimally invasive things. We have to do more complex treatments, which usually involve a combination of what's called systemic therapy or IV therapy, where you're getting immunotherapy or chemotherapy along with potentially surgery to remove the bladder, and or a combination with radiation as well. And so more advanced cases need more advanced care, and that's the muscle invasive.
So if you get to the point where you have to have surgery to remove your bladder, do you how do you deal with that after, when can't live without a bladder, right?
That's a great question. And so that's what I do as a urologic oncologist is we do bladder removal surgery. We manage bladder cancer at all different stages, but we also are specialized in doing the bladder removal surgery. And we do that as a robotic surgery, so minimally invasive. It can be done as open as well, but at WVU we offer both approaches. And then we have to reroute your urine another way to come out. And so there's different ways that we can do that, and we work with patients based on their lifestyle and preferences on ways to reroute their urine to come out, which is we can do through what's called a conduit, or where urine would come into a bag on the stomach, or we also have what's called a neobladder, where we basically fashion a new bladder out of bowel and connect it to the urethra. And so there's different options for complex reconstruction that we offer at WVU for those patients that have to have bladder removal surgery.
Well, WVU's WVU Medicine's urology department, I mean, is top notch, right?
Yeah, you have to have it's not just our urology team, but it's the whole group that we look at.
Yeah.
Because for bladder cancer, as you could tell, for here in West Virginia, again, we talked about patients having more advanced cases, more complex cases, and so we have a whole team that we've assembled with medical oncologists, radiation oncologists, pathologists, who all specialize in bladder cancer, and we meet once a week to go over complex cases. And so it's not just one doctor that's coming up with your plan of care, and you're getting the opinions of multiple specialists to hit your cancer from multiple different directions, which is where you want to be when you're dealing with something like this.
Yeah, that multidisciplinary approach.
Absolutely critical for bladder cancer.
Yeah. So, let's talk about the advances. I mean, because you guys just performed a first in the state surgery not too long ago as a treatment.
Well,
but let's start with what the treatments are.
Sure. So let's talk about bladder cancer in the urologic oncology community is one of the most rapidly advancing fields in what we're studying. And so even over the last few months, it's changed rapidly. Just a few months ago, there's more and more FDA approved medications to give to patients with non-muscle invasive bladder cancer. So people that have recurrence, and maybe the certain medicines that we've used for many years aren't working anymore. Now we have more medicines online for them. One of them is called Enlexo therapy, which is basically, one of the hard things about treating bladder cancer with medicine is that it's hard to hold, because you have to empty your bladder. It's hard to hold for long periods of time.
Yeah.
And so we've overcome that with there's Enlexo therapy, which is basically a stick that goes into the bladder, and when we insert it into the bladder, it turns into a pretzel, so it stays in there. So it looks like a pretzel. It stays in the bladder, and it slowly releases chemotherapy over the course of several weeks. And so every 3 weeks we remove the old device, then we put a new one in that's full of chemotherapy, and it slowly releases that. And we found in the initial studies that that patients are having better response rates than ever before, because before the medicine could just go in and then it'd come right back out of the bladder, so you didn't have very good exposure to the tissue. So that's something that we were able to offer patients now at WVU. Also, for the muscle invasive space, where many patients had to have their bladder removed, there's new medications that we can give IV, combinations with immunotherapy, where patients are having better responses than ever before, and we're figuring out that more and more patients can keep their bladders and not have to have them removed. And so we have clinical trials going on at WVU right now, studying to figure out which patients, after they've gotten medicine, which ones need to have their bladder removed and which ones don't, because less and less patients are needing the total bladder removal surgery these days.
Oh, that's a big deal, isn't it?
It's huge. Yeah, it's a big lifestyle change for bladder removal surgery. And again, we implement it when we have to, but now we're finding out there's certain situations where we're able to work around it, and that's why. And the best place to figure that out is within a clinical trial, and that's why we have them at WVU to figure that out.
And isn't this creating more options for patients that, may not be a good candidate for some of these other treatments?
Absolutely, yeah. In the past, we talked about the non-invasive type, but patients that have non-invasive and they go through all the treatments and it keeps coming back, eventually we would have to remove those patients' bladders because nothing was working.
Mm.
Now we have 4 or 5 other medications that we can try after the cancers come back after the first one or two, which in the past, we would run out of medicines very early and would have to remove the bladder very early. Now we have a lot of different options that are safe, and we can monitor people closely, and we can try and give patients better options who may not be a great candidate for surgery.
Wow. And what about immunotherapy? I mean, that seems to be across the whole spectrum of cancers being used more and more.
Absolutely. And in urology, there's certain types of cancer that we found that respond better to immunotherapy than other types. For example, we treat prostate cancer as well, and many types of prostate cancer don't respond very well to immunotherapy. But for bladder cancer, it's been one of the cancers that responds very, very well to immunotherapy, and especially when we use it in combination with there's what's called antibody drug conjugate medications, which are basically special medicine that's targeted specifically at bladder cancer. And when we use that in combination with immunotherapy, it really does a great job, and it's doing a much better job.
Tell us a little bit exactly how immunotherapy works. I mean, is it a shot? Is it a medicine? Is it a procedure?
Now that's great. Yeah, for bladder cancer, there's different types of immunotherapy that we use. So one of them, the oldest treatment that we used for non-muscle invasive bladder cancer, called BCG. It's a medication that we give into the bladder. That's considered an immunotherapy. It basically gets your immune system invigorated to fight bladder cancer cells. So it's medicine that we put in the bladder, and it gets your immune system really excited, and it helps it find bladder cancer and kills it. And then for more advanced bladder cancers, now we have IV immunotherapy, which are injections that we give into the vein, and that treats your whole body and gets your whole body's immune system revved up to treat bladder cancer. And it can treat it in the bladder and also in other sites outside of the bladder.
Again, more options.
Absolutely, yeah, and we're finding that we can also give combinations now with the IV immunotherapy and medicines in the bladder. There's a lot of clinical trials that are open for bladder cancer right now, more than ever before, because these medicines are so good.
Yeah, I mean, is it fair to say? I mean, this is like been explosive almost, really taking off.
Over the last few months, for sure, just things that are presented at national meetings over this last year have been paradigm changing for bladder cancer, and we would never think about patients with more advanced disease, without not taking their bladder out. But now it's a real change, and it's a real thing that we're seeing. And I'm really excited to see over the next few years how things are going to continue to change.
Game changer, huh?
Absolutely, yeah.
Wow. Um, well, we already talked about the multidisciplinary approach and why that's important, but tell us a little bit about what exactly that is.
Sure. So at WVU again, we've assembled a team, because bladder cancer and more advanced complex cases could involve radiation. It can involve immunotherapy and chemotherapy, and also surgery. Those are multiple different specialists that do all of those different things. And also the diagnostics is important. Having radiologists that have familiarity with looking at bladder cancer, looking at lymph nodes where bladder cancer spreads. And so at WVU, we've assembled a team with an intention to deal with complex bladder cancer cases. And so all around the state, people are coming here to see our team, and that involves a medical oncologist who does chemotherapy, immunotherapy, radiation oncologist who does radiation, radiologist, myself who's a surgeon, and we have support staff that all works together, and we
Yeah.
meet every Wednesday to review complex cases and come up with a team approach for each patient.
What can we be doing right now, though, to prevent bladder cancer?
The main thing is tobacco cessation. That's
Oh,
the main
yeah.
thing. So about if you're using tobacco, increases your risk of bladder cancer about 2 to 3 fold, and about 50% of cases that we see are linked to a tobacco exposure. And so that's probably the number one thing that we can do. Other things are just increasing awareness for early detection. So if we can't prevent it, if we can find it very early, it really increases the options that we have that we're able to offer our patients.
What's the best way to improve early detection?
knowing about the blood in the urine, that's the
Okay.
main one. And then also for our primary care doctors, to also be looking at the urinalysis.
Hmm.
And when you see microscopic blood in the urine, don't hesitate to reach out to the urologist and send the referral in, because microscopic blood in the urine sometimes can be the earliest detection when we can't even see it with our eyes of having a bladder cancer.
Okay. The sooner you find it, the better, always, right?
Yep.
So tell me, what gives you the most optimism? What are you, I mean, because you're very optimistic. Tell me how that translates to patients and potential patients, why they should be excited too.
Yeah,
This is a big deal.
I think patients should be really excited about the new clinical trials that are out, about the prospect of having advanced cancer and being able to find a way to save your bladder, for increasing survival. Bladder cancer is one of the faster growing, more aggressive types of cancer if you catch a bad type, and so many patients are living longer, they're living better lives, and so being in the field and seeing these advancements come out, it's really exciting, and we're excited to be able to offer those to our patients and see in real time, patients benefiting from the science all the hard work that's been done to put these treatments out.
So before we go, what's the most important thing you want our viewers or listeners to know about bladder cancer?
The main thing I want to know, or I want to let people know, is about blood in the urine. Again, so many times we've seen cases where it's been ignored and put off for a long period of time. And so, if you see blood in the urine, it is not normal. You need to let your primary care doctor know, let a urologist know, and go in and get evaluated. And don't put it off, because the earlier we find something wrong, the better chances we have of curing it and taking care of the problem.
Good to know. Good to know. Well, thank you for sharing all this information with us. Again, it's always good to have you here.
Absolutely, yeah.
And especially at a time like this when there's so many advances and so many more reasons for hope for better outcomes.
Absolutely, yeah. We're excited. We'll come as many times as you ask us to come.
Okay.
Yeah,
All right.
we're excited to be here.
Don't make
And
any offers you
yeah,
don't mean.
yeah,
We'll
yeah.
take you up on them.
We're excited we want to let people know about it, and hopefully talks like this get it out to our community, and we can, if one person hears it and seen sooner, then we've done a good job. So
Excellent. Thank you so much.
yeah, thank you.
Well, that brings us to the end of this edition of Live Healthy West Virginia. If you're looking for more information about the WVU Cancer Institute, visit wvumedicine.org/cancer. To find the latest episode of Live Healthy West Virginia, visit our YouTube channel at youtube.com/WVU Medicine, or follow WVU Medicine on Spotify to find this podcast and all WVU Medicine podcasts. I'm Mary Ravazio Menard, and on behalf of Dr. Hajiran and everyone at WVU Medicine, thanks for joining us.